Kelly says, this law does not make sense. Are we encouraging drug use? What's your thought on that?
I mean, I think it's a good question, and I think what we know is that um, people, when they're addicted, they feel this tremendous pull to use drugs. It has the prospect of reducing discarded needles. So the notion of a safe injection site can help just in general with public safety. And to the question, I think that I think that for a lot of people who are addicted to a drug, an IV drug like heroin, having a safe injection site or not won't make the difference of whether they use or not.
Okay. Chuck says, addiction is a sickness. A safe place for them to use would be great. A clean place where they can dispose needles safely. A place just in case they overdose, they can get help. A safe place where disease won't be spread from sharing needles. All you who are against have not faced this with a family member or friend. And how difficult is it for family members and friends to try to help those who are suffering with a disorder?
Well, it's tremendously difficult, and we talk to family members every day, people who are desperate to see their loved ones getting help, and we know that there are just not enough services available for people who have substance use disorders to access treatment at all different levels. And that's just tremendously difficult for family members. I think that among the potential benefits of safe injection sites is that along with the kinds of benefits that were mentioned in the question, by having these sites staffed by medical professionals, the idea is that each time that an individual comes into a site like this, it's an opportunity for a medical professional to interact with that person, to encourage them to access longer term, to the treatment system, to get into detox, and to address any medical issues that they might be experiencing.